Welcome to the WMed Specialty Spotlight Podcast, your virtual mentor for choosing a medical specialty and planning a career in medicine. On this podcast, we probe practicing physicians with questions about their specialty, the decision algorithm that helped them determine that the specialty was right for them, and then for advice about long-term career planning, irrespective of the field they went into. I'm your host, Dr. Biren Shah, WMed Assistant Dean for Career Development. Before introducing today's guest, I just wanted to remind you that selected show notes for this episode and all episodes can be found on our website at wmed.edu/specialty spotlight. The specialty of today's show is internal medicine, and the physician here to tell us about it is Dr. Joanne Baker. Dr. Joanne Baker is the Residency Program Director of the Internal Medicine Program at Western Michigan University, Homer Stryker MD School of Medicine. She is a professor in the Department of Internal Medicine at WMed and is the clinical professor for the Department of Osteopathic Medical Specialties at Michigan State University College of Osteopathic Medicine. Dr. Baker completed her undergraduate degree at Central Michigan University. After completing her medical degree at the MSU College of Osteopathic Medicine, Dr. Baker completed an internal medicine residency at the Michigan State University Flint Osteopathic Campus. She then went on to do a faculty development fellowship at the MSU College of Osteopathic Medicine in East Lansing, Michigan. Dr. Baker is heavily involved with many professional organizations and has served or currently serving in various leadership roles on local, state, and national committees, in addition to her leadership and mentorship roles at WMed. Dr. Baker is a prolific lecturer, having given over 60 lectures at local and national meetings. She has been academically active. Her CV lists over 20 abstracts reflecting presentations at local and national meetings, as well as 3 peer-reviewed publications. Among her many honors and awards, Dr. Baker is a Fellow of the American College of Osteopathic Internists, Fellow of Hospital Medicine, Fellow of the Association of Osteopathic Directors and Medical Educators, and Fellow of the American College of Physicians. So without further ado, Dr. Joanne Baker. Dr. Baker, welcome to the show.
Well, thank you. Thank you for having me, and I'm looking forward to talking about internal medicine.
So you heard me read your bio. Is there anything that you'd like to add, or at the very least, share a little bit about yourself and your decision to go to medical school?
You know, my decision to go to medical school always stemmed from a fascination with anatomy and physiology going back to even as a kid. And starting undergrad, I clearly saw my path going into medicine. It's never been something I regretted. It's something that I've always felt very fortunate and very excited about the field of medicine. It's never boring. It's always changing, and it certainly keeps me on my toes as I progress through my profession.
And the way I like to start off is by reading you a description of the specialty from the Careers in Medicine website, which is hosted by the Association of American Medical Colleges. An internist is a personal physician who provides long-term comprehensive care in the office and in the hospital, managing both common and complex illnesses of adolescents, adults, and the elderly. Internists are trained in the diagnosis and treatment of cancer, infections, and diseases affecting the heart, blood, kidneys, joints, and the digestive, respiratory, and vascular systems. They are also trained in the essentials of primary care internal medicine, which incorporates an understanding of disease prevention, wellness, substance abuse, mental health, and effective treatment of common problems of the eyes, ears, skin, nervous system, and reproductive organs. So how much of that do you agree with, and what would you add or subtract to ensure that anyone listening was well informed of the practice of internal medicine?
I think the hardest part about describing internal medicine is that it is so broad that it would be very hard to be one physician who did everything in that arena. And it's one of the reasons over the years that medicine has become even more specialized. There's very few general internists that do both hospital and office. And I think as chronic illnesses has been becoming a bigger issue, people are living longer, the field of medicine has just broadened so much. And it doesn't include the fact that internal medicine is the groundwork also for the stepping stone into subspecialties. And there's over 23 different specialties of medicine that you must have a core understanding of general medicine before you can step into cardiology, pulmonary, et cetera. So it's one of the things that actually drew me to the specialty was the fact that there were so many options and places to practice. And depending on where you're doing it, it's a very different experience.
Can you tell us through what a typical daily or maybe weekly routine looks like for you, followed by the typical series of patients that you would see, and what are the typical outcomes for these patients?
The typical day is going to be different if I was pure primary care in the office, working 4 days a week, or if I was a hospitalist rounding, and even the scope of diseases I'm caring for are going to be different in those two arenas. As an academic internal medicine physician, I actually love it because I get to be in both arenas. I work with my residents in the clinics, so we see patients who are coming in for wellness, preventative health care, but also management of chronic diseases and also management of acute problems. And so there's no typical patient day because of that reason. And I round in the hospital with my residents. I get to see patients at both hospitals, and the scope of diseases there are very different. And the focus of what I'm doing is different than when I was in the office. I'm taking care of an acute need or I'm managing chronic illnesses to get them back to their baseline. And again, the variety there varies from week to week. It's never the same. In more rural areas, you're going to see physicians who get to do both. But in a more common place across the country, most general internists are focusing on office or hospital, or they end up, doing something like I'm doing in academics where I get to do both. And that's one of the reasons I love my job.
What is the difference between the practice of internal medicine look like inpatient versus outpatient, academic versus private, urban versus rural setting?
My residents that have graduated and are doing primary care outpatient, for the most part, are working 4 days a week. They're seeing patients 4 days a week, but they may have a half day where they're catching up on the tasks of medicine, following up on the results, the messaging, the forms that need to be filled out. And they may share call on the weekends where they're answering service calls with their partners. In the hospital setting, that also is a very wide degree. There are many hospitalist groups that work 7 days on, 7 days off. I have some residents who work only nights. Residents who have graduated, some that work only days, some that do both. And so there are such things as nocturnists or hospitalists. And they're really, they could be working 8 to 12-hour days. Some of their days might be just admitting people through the ER and getting them into the hospital. Other days might be rounding on them and managing their acute problems. But that day would also include meetings with care managers and social workers. They're going to be coordinating care with the families. And so it's not just a matter of seeing the patient every day. There's a lot of coordination that happens in the care of that patient, getting them from admission to discharge. You're also working with specialists very often as well. If you're in a rural setting, you really have to have a broader scope of practice to be able to provide the care for your patients and maybe do more procedural care than you would if you were in an urban environment where there's a lot more specialties available. So being skilled in doing more office procedures is going to be more important in a rural setting than it would be in a more suburban or urban. And so your scope of practice may be broader in that regard.
What do you find most exciting about your specialty? And conversely, what do you consider most mundane about internal medicine?
I think the thing that drew me into the specialty is the variety. Every patient is different, their needs are different, and even just the scope of medicine has changed so much. The Harrison's Book of Internal Medicine, when I was a resident, was one volume. It's twice as big now, and just the knowledge and scope of medicine has changed so much, and so you can't get complacent. You need to recognize you have to grow with the field of medicine and the needs, the preventative needs and the planning. So some of what excites me is the opportunity to coach wellness and coach prevention, but also be there in the times of need and at the most intimate and most desperate moments of a patient's life, and be that person to help that patient and family through a really challenging time. And so it really, there could be celebrations, but there can also be a lot of sadness. And it's that degree of variety and change that there's never a day that's the same. The mundane part, I thought about that, and I'm sure all of us would say the frustrations of the administrative, the growing part of EMRs and documentation and all that. I think that's same across all fields. But I would imagine what might be, less exciting for me is going to vary from every internal medicine. There may be diseases that are not as exciting for me and maybe more challenging just because they lack some excitement for me. But I don't think that's going to be the same for every internist. Everybody's going to have a different thing that's going to be a special niche that they're interested in, and other areas that might not be as exciting. So it'd be hard for me to say that there's one thing that's mundane about internal medicine, because it's going to really be individual.
What is one thing that you would have wished you would have known before entering the specialty? And what would you encourage a medical student to think about in earnest before going into internal medicine?
Even if somebody is interested in subspecializing and is enthralled with maybe a subspecialty of medicine, no matter what, you need to have that solid foundation of internal medicine, that broad scope of knowledge. And you have to think about the training that you're going to go through. Somebody who really wants to be in an office practice needs to recognize that residency is going to put them in the hospital and in the office. There's going to be training that's going to make them exposed to different arenas, but they're going to grow from that. And so I think, keeping broad ideas open, the big thing about students is that they have not experienced all the many different areas of internal medicine. And I think the biggest mistake I see is focusing on one specialty, one area, and then having blinders on to other areas that might really spark an interest and be passionate for them. And so I think recognizing that internal medicine can be so many options. It can be so many different things, and not to think that because you did your hospital clerkship that that's just internal medicine. It really can be subspecialties that are in the office. And so some people are not interested in doing general medicine in an office. They might enjoy being a subspecialty in an office. The same is true for people who get excited about the hospital but want to take it more. You don't have to know what you want to do from the start of being a third-year student. I have had many residents who, even at the end of residency, love general medicine but aren't certain if they want to specialize. And one of the things that actually drew me to the field of internal medicine was thinking, what's going to keep me excited for 40 years? And I liked the idea that even 10 years into my practice, if I fell in love with a specialty, I could then choose to still specialize in that specialty. There's not a time frame that you have to follow. And so I think it can be overwhelming as a student because they're only exposed to core specialties, and to think about when they're doing those rotations, what about the rotation got them excited? Was it the environment? Was the disease processes? Was it the patient interactions? And hopefully that will help them kind of figure out what arena is going to keep them going.
I'm glad you bring that up, because I think for students, they only see a sliver of a specialty in a short, finite period of time on the rotation, and so it's unfortunate that's the way it is, but that's their picture of that specialty in that finite period of time, and also seeing only a portion of internal medicine in the hospital, as you mentioned. So thank you for that. What do you think is the biggest challenge facing internal medicine, and where do you predict the specialty to be in maybe 10 or 20 years from now?
I think the challenge is that with people living longer and more chronic illnesses and the blessings of better and better treatments, medicine is becoming more complex. And I think that the challenges are we actually need more primary care people on the front lines managing diseases. But I think some people shy away from that because it's so all-encompassing. And so the idea of specializing may sound like something attractive, that narrower scope. I actually thought about doing a specialty when I was a resident. And when I talked with a colleague who was a fellow in that field, and he was asking me a very basic question about general internal medicine. And I thought maybe he was just joking around with me. And I'm like, you should know this. And he said, no. He says, Joanne, I can only study GI. I can only read GI. And that was the specialty that was drawing me in. And I suddenly realized that for me, I wasn't so passionate about the field of GI that I could only read and study GI. And it was at that moment that I realized I loved all the different fields of medicine, and I wanted to be able to stay in that. So I think that we need people who can also be that quarterback person to manage patients' care. And we just don't have enough of them. And I think it becomes, as a result of both primary care, family medicine, med-peds, internal medicine, we're seeing a lot of partnerships, to make it work on the front line with advanced practice providers and kind of having a team approach to primary care because it's becoming challenging. But I'm going to flip it around and say, but that's the rewarding part, because you're getting that long-term relationship with the patient and helping them through all those processes. And there is so much greater patient satisfaction with dealing with their primary care physician as opposed to going to see a stranger and a specialist. And so I think we're getting better at doing more team-based primary care to make it more attractive so that it's not so overwhelming for the people to choose what to do with internal medicine.
Are there any resources that you would, whether it's a website or any resources that you would recommend to a student who is wanting to learn a little bit more about the specialty of internal medicine?
Yeah, I think websites are probably going to be the most up-to-date places to go and learn about internal medicine. And the American College of Physicians, I think, is probably the largest database and website for physicians. For osteopathic students, it'd be the American College of Osteopathic Internists, same kind of concept, a very broad overview of general internal medicine, but also giving them an education of what medicine is and also the many different subspecialties within internal medicine. Many of them have, if you go to the ACP, there are sites specific for medical students to kind of help them. And they can even develop mentors. They can ask for a mentor within the ACP and get assigned somebody to kind of help them answer the questions that may not get answered on this podcast.
Can you tell me how you came to the decision you wanted to go in internal medicine, maybe the struggles that perhaps you might have had, or any insights, and when that eventual aha moment came when it all made sense that internal medicine was right for you?
Yeah, I started my third year clerkships with the idea that I thought I wanted to do primary care, all ages. And I went into each rotation kind of open-minded, and I enjoyed almost all my rotations. Even though I knew I didn't want to be a surgeon, I still found my surgery clerkship fascinating, and the experiences to be in surgeries I found fascinating. But I realized that wasn't, that fixing the problem that way was not what was going to keep me going all day long, and I couldn't stand that long either. I found when I looked back on my year and I talked with residents, they kept asking me, what were the rotations that you kept comparing others to? And what were the ones that I just enjoyed the most? And they were all my internal medicine rotations. I enjoyed my family medicine rotation, but I definitely found more excitement in the hospital. I also, my last rotation was pediatrics, and I realized that my heart, I was not going to be able to keep the things that I saw and did on peds at work and not bring it home. And I'm very thankful for the pediatricians we have in the world. I just also realized that being an internist was, in a sense, specializing. I narrowed the scope of knowledge that I was going to have. I wasn't going to be doing OB. I wasn't doing pediatrics. I wasn't going to be doing orthopedics in that regard. You still do it, but it's in a different regard. So I saw it in a way of kind of specializing. And then when I talked with the residents, I realized that, again, I was in my 20s. I didn't know what was going to keep me happy for 40 years. I loved that I could, over the course of my career, change and alter as my interests changed. And there were so many possibilities in the field of internal medicine. And that was before the field of hospitalist medicine even began. So it just, it was that decision process that kind of brought me to internal medicine. Those rotations, cardiology, GI, were the ones that just kept me the most excited.
If you were a third-year medical student, undecided on a specialty, with limited time remaining before residency applications were to be submitted, what do you think would be the fastest, highest yield route to making a decision about the specialty?
Hopefully they've at least narrowed it down so that they can at least reflect back and decide what settings are they most enjoyment in. And they've talked with residents to kind of see like what is, or even better, attendings, what their lifestyle is like. Because choosing a field of medicine to specialize in, you have to be passionate about the medicine itself, but you also have to be aware of where it's going to be delivered and how it's going to be delivered, and that is going to satisfy you personally as well. So that where the medicine is being delivered is going to be really important. I think that if medicine is something you're interested, talking to people in the field, a primary care internist who's doing office medicine is going to have a very different perspective on the field than a hospitalist. And I know on clerkships, they get exposures to physicians in the hospital, they get exposed to hospitalists. I don't know if they always get exposed to primary care physicians in the community who are in private practice. So, seeing if they can get that exposure might help open the door to considering, different places to practice.
Do you feel away electives are necessary in internal medicine?
No, to do an away elective is not important in matching into the field of internal medicine. The field is so vast, and there's no way that, program directors would ever expect you to rotate at all the institutions you're applying to. Being that, I would say that it's important for students to be exposed to different environments, because there are vast variability in medicine residencies depending on the size of the program, if it's an academic or community-based program. So I tell students that I think it's important to do auditions to be exposed to different types of training environments, so that when you're choosing the places to apply to, or when you're on the interview trail, you have a better idea of what questions to ask, and you'll have a better knowledge of what it feels like to be in a setting that is different than what you trained in, whether you trained in a place that had fellowships or no fellowships, a very large program with class sizes of 40 or 50 in each class versus a very small community-based program. That's, to me, what the purpose of the auditions are to help the student in their decision-making of where they're going to thrive in that 3-year residency. Obviously, if you're going to do an audition, choose a place that you would seriously consider to train in, because it will give you that little bit of a leg up while you're there for people to get to know you. And obviously, you're going to put your best foot forward. You're going to make sure you meet the residents and meet the program directors. But you're going to be applying to far more people than the time you have to do auditions. And so I think auditions should be more of a fact-finding mission for the student to help them better determine the best place for them to do a residency.
How important is research or scholarly productivity for matching into internal medicine?
I think there are some programs out there that there might be an emphasis on scholarly activity, and that's where research is important to look at the programs you're looking at applying to. For internal medicine, it's not just scholarly activity. I think that we are looking for people who are doing more than just studying. And to be honest, medicine is very team-based. So when we're looking at applications, we're looking at what did you do during medical school that involved you working in a group dynamic. So it could be a scholarly project as a group, but it could also be leadership opportunities in organizations where you're working within a group. It could be community outreach and doing things, outside yourself and doing things in the community. I think program directors, we're not looking for 12 identical or 20 identical residents. We're looking for a variety of experiences to help the whole. So for some, it might be a student who has done scholarly activity and that shows they did that extra. But it doesn't mean that if I'm looking at somebody who's never done a scholarly activity but was involved in community groups and they had leadership opportunities and they did outreach, that might also bring something to my program. I think the biggest risk a student can take is to try and do everything at the sacrifice of their own learning on their rotations. And I think balance is really important because in the end, you need to be learning on your clerkships, studying for your exams, and finding what inspires you. You just can't do everything.
Is there anything else you think that a student should know or can or should be doing to be a competitive applicant matching into internal medicine?
I really think it's that you're not going to be everything to everybody for all the 600 plus residency programs out there. So when we're interviewing, we can see what is making people passionate and what isn't. And so I think really being true to what's important to you. There are some people that street medicine is something that is just inspiring for them, and working with our unhoused population and that can be seen in the interview. We look at their application and we see that and we're trying to connect with that student. So I think not being something that they're not and playing to the strengths that is true to them. That's what we want to see. We want to see somebody who is true to themselves, doing things that they're passionate about. And for some, that's research and scholarly work, which is wonderful. But for some others, it might be outreach, and they may be the presidents or vice president of their organizations at their med school. And the reality is in medicine, it's all about team. You have to work in a team environment in the hospital. You work as a team in residency. And so that's what we're looking for, is people who are genuine, who are excited about medicine. They're doing things that they're passionate about, but they're able to work in a group. I always get worried when I look at a resume or a CV that there's a lot of activities that are solo-based activities, and I wonder how happy they're going to be in the field of medicine where everything really works in a team and in a larger environment.
If you had to go back and do it all again, what would you do differently, and what would you do the same, and why?
I guess I don't think I would do anything differently per se, because I think the journey that got me to where I am, and I'm very happy with what I'm doing. If I did any different, I might not be where I'm at now. And I feel very fortunate with what I get to do now. But I also look at my career as altered and changed over the last 30 years. And there have been times when I stayed in a position that maybe was not as fulfilling in that moment. And I think there are so many different aspects of medicine, not just the field of medicine, but where you do it. I think it's important to be mindful that you need to look at the environment you're in, the people you're working with, and if you're not happy, kind of look and see and recognize that that medicine offers so many opportunities that you don't have to stay stuck in one area. And I think sometimes it took me a little longer to recognize that I needed the change. And being open to the change, I think, is what got me through my career path to where I am now. And so I think because somebody chooses to go into the office doesn't mean that for the rest of their career they're going to stay in the office. And so I think that they need to just be mindful that there are opportunities. And it could even be taking on an interest in the community and being an advocate for an area within medicine and doing that outreach to add that variety to your practice. It doesn't have to be a complete career change. It could just be taking on a niche and becoming a specialist within your own area and paying attention to what keeps you passionate. Medicine is hard, and I think we have to be intentional and purposeful in making sure that we maintain that spark and passion and don't allow burnout to make us cynical and negative to a field that has so many opportunities.
What would you say is a career mistake that you've seen other physicians make?
Some of the things that I've seen people in the past do is not researching the group that they were going to join and really having a good understanding of what they were getting into when they moved to an area. And I think when you're taking on a new job, buying a house and settling in before you've even looked at the community that you're going to be joining has been the one piece that residents have told me over their career that they had wished they had taken 6 months to make sure this is the right job, the right group, the right place before setting down roots. It's much harder to make changes once you've done that. That's been one piece that's come up multiple times over my 30 years. I think that being careful about burnout is I can't emphasize that enough. I think finding ways to keep balance and being able to say no sometimes and not getting overcommitted on the job. It's very easy to get asked to be on every committee and on every work group. And that's even if you're in private practice outpatient or if you're in the hospital. So I think being intentional in what you decide you're going to do and not do, I think is important to maintain that balance.
What is something that you've seen another physician do well that has made you want to emulate it?
I've been very fortunate to have several mentors, and I think the two that come to my mind are incredibly humble and have humility, and I've always been in awe at their ability to recognize and say when they didn't know something or when they made a mistake. And in medicine, that's hard to do. I think sometimes there's an expectation that physicians be all-knowing. And when I look at a couple of my mentors, I've just their heart and really putting the focus on the patient at the core of everything has been something that I've tried to remind myself as, everything we're doing, if you step back and you look at, what's the best for the patient, what's the best in the moment, and not get caught up in all of the extraneous stuff. I guess that to me, I sometimes have to remind myself to do. I've been very fortunate to have several mentors along my career path, and so those are the things that stand out.
What is one thing that you're struggling with or lamenting about your career today, and what are you doing to remedy it, and what would you encourage a medical student to do right now to help avoid this problem entirely later?
I don't think I'm necessarily struggling with anything. And when I look back at my career, I think the things that I wish I had done better at, and I think is a constant struggle, is finding balance between my work and personal life. I think the generation coming up in their 20s and 30s now are doing a much better job of keeping that balance and kind of keeping it in mind compared to kind of the workhorse mentality of my generation, where there was this sense of pride if you worked 80 hours in a week, as opposed to thinking, wow, that was time away from your family when you worked 80 hours a week. So I think there's been a lot of lessons learned in my career where I've had to step back and make sure that I'm being intentional and purposeful and trying to maintain balance with my family and my own personal well-being and my career. And it's not something that happens by accident. You have to really be intentional and mindful of it. And it's easy to get it lost and then all of a sudden look back and go, oh, this was not a healthy period of time. I need to regroup and bring it back. So I think when we talk about wellness with students and residents, it's not just to get them through that moment. It really is a passion of mine to tell them that, no, this is something, these are the things you need to carry through the next 40 years, not just in the moment.
What is one book, medical or non-medical, that you think every person pursuing a career in medicine should read?
It always is the most recent book that I've read, and so that's the one that stands out. But I personally think, especially since so many of our residents and students are in their 20s and hopefully have never experienced being a patient or having a family member being a patient, I have found the most rewarding experiences in books are the ones that talk about patient experiences. When doctors become patients, stories about patient experiences. The most recent one that I've read was called In Shock, and it shared the story of a critical care physician's personal experience as a patient. And when I read those, I'm constantly reminded about what it's like to be a patient in this medical system. I think we get taught a lot about how to be a doctor and the medicine, but I think the things that we have to, because the patient experience is very different now than what it was 2 decades ago. And so for me, I think being aware of what it's like to be on the other side and having that empathy and knowledge, I think is really important. So I can't point to one book, but those are the books that I gravitate towards, and I'm always learning something and being reminded of something that I try and share with my residents as we go through these experiences.
Dr. Baker, is there anything that we have not covered that you want to make sure our listeners know about the specialty of internal medicine?
The thing I just want to emphasize greatly is that I think it's an exciting field. It's ever changing, and it's incredibly rewarding to be a part of a patient's experience and seeing them get better or walk alongside them in the challenging parts. But it's also so much more than that. And I think for students who are trying to think of where they want to be, it's not just general internal medicine. There are so many fields within medicine that you can branch off into that we need as well. And so to look and recognize that you can be a specialist in almost any area within internal medicine, as well as being a generalist. And to me, it's all those many opportunities that to me makes it the most exciting field, in my opinion.
Mm-hmm. Yeah, no, you're right. And it's just the opportunities of fellowships to move on if you wish to. And so, yeah, there are a lot of different career paths. I completely agree. Well, Dr. Baker, I really appreciate you taking the time to talk to me. I hope you enjoyed the conversation with Dr. Joanne Baker. For the resources and other tidbits that were mentioned in this episode, you can find them in the show notes on the WMed website. If you liked what you heard, please share this episode with your fellow medical students, especially if they're having some career anxiety. It is truly my hope that these conversations with physicians who have been there and done that will help you move forward with your own career choices. For any questions, or if you would like to reach out to me for any reason, which I encourage you to do, you can do so by emailing me at biren.shaw@wmed.edu. But until next time, take care.